We've arrived on scene to a young man who's fallen out of a tree. He's got a laceration on his arm and an angulated right leg. I can see that he's losing blood, however I cannot tell as much as he is on grass. The saw is out of our way and is not a hazard. Other than that, there are no other hazards present. Do you have his safety into the scene?
Yes.
Cool. When we're going, can you please do the vitals?
Okay.
Let's go. Hi sir, this is Sam. No, I'm Holly, we're from the ambulance. What's your name?
My name's Gareth.
Hi Gareth. Can you tell me a bit of what happened today?
Well, I was cutting some branches and I fell off a tree.
Oh, that's no good. Okay, so I can see that you're bleeding here, so I'm just going to tend to that wound, and while I'm doing that, Sam's going to do some vitals. I can tell that he has a high GCS and his airway is clear, is he talking, alert, and responding fine. So I'm going to put some on the crate bandage to ensure that it doesn't stick to the wound itself. I'm also putting twists. And just tucking that in there. I'm now just going to feel for his pulse, feeling it for 15 seconds and timesing that by 4. Feeling for the warmth of the skin as well as the strength regularity of the pulse. I can still feel a pulse and the capillary refill, and that is still present as well. Okay, so I can see that you're still bleeding here, so I'm just going to put on a second set of bandages, okay?
Okay.
So I'm just going to put another load of bandage using the same technique as before, creating a base and then wrapping it around, putting a few twists on the cut itself to put in more direct pressure. And I'm just going to recheck your pulse. It is still there but very faint, and the capillary refill time, it is prolonged but it is still there. So I'm just going to get you to elevate that a little bit, and while we wait to see if that stops the bleeding. See that the second bandage isn't working, I'm now going to apply a tourniquet. So sir, a tourniquet looks a bit like this, and it's just going to sit on your arm, on your upper arm, okay? So what I'm going to do, I'm just going to open it up, slide it through the arm, putting it 10 centimeters proximal to the wound, as well as ensuring it's on a single bond limb. Okay, so it's going to feel a wee bit uncomfortable and a wee bit tight, but that's to help stop any further bleeding.
Okay.
So I'm just going to tighten that up there, put that under there, write that down, and also write the time of which I put it on. I'm then going to take off any of the further bandage so I can see if the tourniquet is doing its job. If this were a live situation and not a demonstration, I would cut the bandage as it will be faster. Now that I've taken off the bandages, I'm just going to assess the wound. I cannot see any blood coming out of it. Checking the pulse, I cannot feel a pulse, and there is no capillary refill time, as there is no blood getting to this half of the limb. So I'm now going to do a trauma sweep. So sir, I'm just going to touch you from head to toe, feeling for any further injury. Is that okay?
That's okay.
Cool. So I'm just going to start at your head. I'm going to start at the head, moving my way down, looking in the ears if there are any blood, feeling the face for any facial fractures, going down the back of the neck.
Oh,
Okay, so do you have a bit of tenderness down there?
yes.
What kind of pain is it?
It's really sore.
Okay, is it towards the middle or the sides?
It's in the middle.
Okay, so that indicates that it could be a spinal injury, a midline spinal, as it was a high mechanism of injury falling, and he's got some pain down there. So Sam, can I get you to please hold the head for me? Cool. Well, Sam holds the head. I'm just going to continue down, okay? So I'm just going to feel down the arms, looking for any blood as I go down. I'm going to come the collarbones, down the sternum. Take a deep breath in, out, feeling for any irregularities in the ribs and the breathing, which there is not. Palpitating the abdomen. Cannot feel any down there. Putting a bit of pressure on the pelvis. No pain in there. I can see that this leg is angulated, so I'm just going to continue down the other leg. Nothing up in there. And the other leg going only as far as he tells me. Alright, so now that I've finished the trauma sweep, I'm just going to put a collar on. So I'm just going to open this up here, grabbing a towel. I'm just going to put a towel under your head, sir, just to help your head. So Sam, can you lift it up ever so slightly? And placing that back down. Cool. So what I'm going to do is put on a collar, okay? A C collar, sir. So it looks a bit like this. And it's just going to wrap around your neck, making sure that it helps to stabilize it. So I'm just going to measure with my fingers from the jaw to the neck, which is about 4, maybe 5 fingers, which I measure on here, which it already is, which is at the no neck setting. However, if I was to change it, I'll just click those buttons there and move the yellow thing up and down. So what I'm going to do is I'm just going to slide this under your neck, and it might be a wee bit uncomfortable, sir. However, it's going to help become a wee bit stable for you. Okay, so I'm just going to bring that up and over and then secure that with the Velcro. Right there. And Sam, you can slowly let go, and we're just going to use 2 towels to secure the neck. So if you could just pop that one on that side, and I'll pop this one on this side. So that's just to make sure that you don't move your head anymore. So we're just going to be speaking to you from now on. So please try and minimize your movement. Now that we've done the C-collar, I'm now going to move on to the pharmacology and the potential fracture. So what I'm going to do is I'm going to ask them on a scale of 1 to 10, how strong is your pain, sir? 10 being the highest.
8.
8, so that shows me that he would be in need of some pain relief. So I'm going to use methoxyflurane. So sir, have you seen this drug before?
No.
Have you heard of the green whistle or methoxyflurane?
I've heard of it.
Cool. So have you had it within the last week?
No.
Have you had a history of any renal issues?
No.
Or kidney issues? You don't have any malignant hypothermia problems in your family?
Not that I know of.
You're not allergic to this medication?
No.
Okay, cool. So he doesn't have any contraindications to this, so I'm just going to quickly do a drug check, checking that it is methoxyflurane. It is in a 3 milliliter ampule. It expires December 2020. It will be given to Gareth here, and it will be administered orally through this mouthpiece here. So I'm just going to get my offsider Sam just to double check that for me.
Yeah.
So could you please repeat back everything I just said?
Cool, so we got methoxyflurane in the 3 ml ampule, expires December 2020.
Cool. Now that I know that the drug is safe to use and he doesn't have any contraindications, I will be now administering it. So I'll put the armband around his arm, bringing it up, and if he were to use it, he would just take a few deep breaths in his mouth there. However, I'm using a mannequin, which he can't do that for himself. Okay, so I'm just going to pop that there, and I'm just going to move down to the leg. So in order to do that, Sam, can you please go and get the box splint ready for me?
Yeah.
Please, and bring it down to the leg. I'm just going to move that down, and while Sam's doing that, I'm just going to expose both of the legs. Is that okay, sir?
Yeah, that's fine.
So I'm just going to expose the leg as best that I can. In a real situation, we would cut the pants. However, as this is demonstration purposes only. I would also advise that would be particularly sore on this leg here. Cool. So what I'm going to do is, sir, I'm just going to feel your both of your legs and check some of your vitals. It may be particularly sore, so you might want to take a few more breaths of the methoxyflurane.
Okay.
So I'm just going to check his century by saying, can you feel this, sir?
Yep.
How about this one?
Mhm.
Can you feel this?
Yep.
What about this one?
Okay.
I was also checking for a capillary refill on there, which I can both see. Can you wiggle your toes for me? As once again, as a mannequin, he would wiggle his toes on both feet. Cool. I'm also going to check the pedal pulse on both feet, being as gentle as I can on the potential fractured foot. Okay, cool. Now that, and while doing the pedal pulse, I was looking for the colour and warmth of the skin. the regularity and strength of the pulse on both feet. Okay, sir, so we're just going to put your foot in a splint now, and it might be particularly painful, so take a few more deep breaths of the methoxyflurane.
Okay.
So Sam, can I get you to come around here, and we will sort this leg. So I'm just going to realign the leg, and Sam, can you slide the splint in underneath? So once again, sir, it's going to be particularly painful.
Okay.
So I'm just going to lift it up, realign, grabbing both sides of the leg. In doing this, it should help to relieve any pain, align all the blood vessels, and make it more comfortable for the patient. So sir, I'm just going to lift it up one more time so we can secure the splint, okay? But this time I won't be touching your leg, just the splint itself. Cool. And I'm just going to tie that up here. Trying to be as gentle as I can, making sure that I'm not putting it on the fracture itself. We could identify the fracture using the plastics acronym, as well as looking at it as well as it could be angulated or anything like that. So I'm just going to check his pain scale again. So out of 10, how sore are you now?
It's about a 4 to a 5.
4 to a 5? Cool. I'm just going to do your baselines again, okay?
Okay.
Can you feel that?
Yes.
How about this one?
Yes.
How about me touching your toes?
I can feel that.
Also checking for capillary refill, which seems fine. Can you wiggle your toes for me? Cool. I'm also going to do the distal pulse. Pedal pulse, sorry, not distal pulse. Cool. About here. Cool. So now that I'm okay with the splint in place, I'm now going to do a set of vitals myself. Is that okay, sir? I'm just going to do some vitals
That's fine.
now. Okay, so I'm just going to start off by checking his capillary refill on his arm, which is cool. Then I'm going to do his heart rate, which I would, once again, do for 15 seconds, times that by 4 to get an accurate reading, and then feel for the strength, regularity of the pulse itself, while checking for the colour and warmth of the skin. Cool. So Sam, can you please tell me what the vitals were for earlier for the capillary refill and the heart rate?
Yeah, my heart rate was 95 beats per minute, and the capillary refill was 3 to 4 seconds.
Cool. So I just got a capillary refill of 2 seconds, which is in the normal range of 2 to 3, while the heart rate I got as 75, which is once again normal, as the normal rate is anywhere from 65 to 100. So now I'm just going to do his blood pressure. So sir, I'm just going to wrap the BP cuff around you, okay? It may feel a wee bit uncomfortable,
Okay.
and it might feel a wee bit tight, but it won't last for long.
Okay.
So I'm just going to align that with his brachial artery, so I can get his brachial pulse. Popping that on there. Grabbing this here. Cool, just untangling this a little bit. Okay, so I'm just going to feel down here. Just going to pump that up, making sure that it's done up. Cool. And now, sir, I'm just going to put my stethoscope on your upper arm here, so if it feels a wee bit cold, that is why. Cool. So I got a BP of 115 over 70, which is in the normal ranges of around 120 over 80. Sam, can you please tell me what you got earlier?
Yeah, I got 90 over 60.
Cool. Now that I've done the BP, I'm also now going to do his rest rate. So without telling him, I'm just going to, if it was a normal person, not a mannequin, I'll get him to raise his arm over his chest like this so I could watch the rise and fall. However, as it is a mannequin, I'll just look straight at his chest, looking for the rise and fall, the depth, and the rate of his breathing. And I'll do that for, once again, 15 seconds, and then timesing that by 4. Okay, so I got 18, which is in the normal ranges of 12 to 20. Sam, what did you get earlier?
It was a little bit higher at 24.
Okay, thank you. So now that I've done that, I'm just going to auscultate his lungs. I'm going to listen for any crackling or wheezing. So can you take a deep breath in? Cool. And this side. Down here. One more time. Cool. I do not hear any wheezing or crackling in his lungs, indicating that there is no fluid and he is breathing normally. So now what I'm going to do is I would consider long-term pain relief. So sir, how much pain are you in now?
About a 4.
Okay, so his pain has subsided quite substantially. However, for the journey, I would like to make it as comfortable for him as possible by giving him longer-term pain relief. So I would give him a pain relief such as paracetamol, which I could take either in a tablet form or in a liquid form. So, sir, have you had paracetamol before or Panadol?
Yes.
Have you had it within the last 4 hours?
No.
No? Do you have any tummy or abdominal pain?
No.
You don't feel nauseous?
No.
Cool. So I'm just going to do a quick drug check, checking that it is. So this says it's paracetamol, 500 milligrams, and it expires September of 2019. Sam, can you please double check that for me?
Yep. Paracetamol, 500 milligrams, and expires September 2019.
Cool. Now that I know that the drug is safe to use, I could administer this in the ambulance by getting him to grind it up, or I could grind it up for him, putting it under his tongue for the mucosa to absorb, or I could give it to him in a liquid form. So how much do you weigh?
60 kgs.
60. So now that I know that he is a grown adult and he weighs 60 kilos, he would be allowed 1 gram, which is 2 tablets of paracetamol, or it would be 20 milliliters if I was to give it to him in a liquid